For Yasmin Hasham's mother, getting around has become noticeably harder during the pandemic.
Before she would get out, there was more exercise. So now the thought of getting out of the house is scared. So
Her
we
weekly
decided
seniors
to
group hasn't met in person in over a year. She wants to go back to those days.
So we can talk each other and laugh sometime for 1 hour.
They're trying to bring back the laughter at this seniors online art class.
Being cut off from each other has been a real heavy strain.
For some elderly people, that strain of the pandemic has led to more social isolation, malnutrition, and inactivity, accelerating mental and physical decline, which experts call deconditioning. There isn't much Canadian data about deconditioning, but people who care for seniors say they're seeing more of it.
And has often led towards the necessity of long-term care.
Next to COVID-19, the signs of deconditioning are subtle, but no less arresting, even for this geriatric emergency doctor.
In going through his symptoms and complaints, the thing that was heartbreaking, that he was dying of loneliness. And I didn't know how to help him.
Lee's now researching how to treat seniors' pandemic isolation with hospital volunteers who call them up weekly just to talk. He says elderly Canadians are losing their quality of life prematurely.
We won't know how bad it was for 5 or 10 years. There's a whole generation of older people that may suffer consequences.
You want her to see go up?
Yasmin and her mother are still trying to stay connected with others on the phone and online, but it's not enough.
Now, every day is the same.
And that has worrying consequences. Vic Adopia, CBC News, Brampton, Ontario.